Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Kelly Koval, clinical nurse educator with Women's Services at Novant Health Brunswick Medical Center. We'll also speak with Shelburne Stevens, Novant Health Brunswick Medical Center's president, about a new community initiative. Our final guest today is Sarah Brown, nurse practitioner of Novant Health OBGYN, who will discuss endometriosis. Stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Kelly Koval, clinical nurse educator at Novant Health Brunswick Medical Center. Welcome to our show today, Kelly.
Thank you, June. Nice to be here.
It's very nice to have you. And to start off with, how long have you been in the area?
My family of 5, we came from California and we landed in North Carolina in July of last year.
Wow, all the way from California.
Yes, ma'am.
What brought you here, Kelly?
Well, there was this opportunity for women's and children's wellness position, and I jumped on it. And so we packed up and drove the 3,000 miles and showed up in Brunswick County.
And here you are.
Here I am.
Well, let's let our viewers get to know you a little bit better. Tell me a little bit about your education and your background.
Okay, well, I've been an RN for 12 years. I have my master's degree in nursing education. During that 12 years, I was a labor and delivery nurse, a pediatric nurse, and then I taught for community college for their nursing program.
Wow, lots of education.
Yes.
Well, that's wonderful. Well, let's talk about your role at Brunswick Medical Center. Okay. What is it that you do at the medical center?
So my official title is the Women's and Children's Community Outreach Educator.
Wow.
Yeah, quite the lengthy.
That's a big title.
It is a big title. And what our main focus is to really, we have 3 goals that we're trying to meet, and we are trying to educate the community on those goals.
Let's talk about what's offered in the Women's Services Department at Brunswick Medical Center.
Oh, it's a beautiful service line, and having come from California, I have seen a lot, and I can say it's hands down one of the most gorgeous units I've seen.
Wow.
But it really starts in the OB office, and then from there we've streamlined it so they get all of the information they need, and then they come on our unit, and we do offer testing if we need to do testing prior to the baby being born. We have labor and delivery, and then they stay in the same room, and they have their postpartum, and then they get discharged home.
That's awesome.
It is a great setup.
Sounds like it must be a beautiful place, the way you describe it.
It is beautiful.
Wow. Well, I probably won't have the opportunity to see that, but maybe I'll visit.
You can come visit.
Wonderful. Well, today we wanted to specifically learn more about the Novant Health Foundation Brunswick Medical Center's Women's and Children's Wellness Outreach Initiative, and that is a mouthful.
It is.
First of all, what is the initiative?
So the initiative's main focus is to provide education on based on 3 factors. And those 3 factors are to try to increase breastfeeding rates, to decrease childhood obesity, and to decrease smoking cessation in pregnant women. And those were 3 things that the foundation and the community have identified as real problems in Brunswick County.
Wow, and they sound like all 3 really good things.
They are.
So how is it that you're involved with the Women's and Children's Wellness Outreach?
So I've collaborated with the health department, the pediatricians, and other wellness promoters. And together we're able to educate and give resources to members in the community based on those 3 initiative topics.
We have an awesome health department here in Brunswick County.
We really do.
They do a phenomenal job in many areas, and I can't give them enough kudos for that. And I just have to say that on the show.
Completely agree.
I think they are awesome. So these three topics that you mentioned, childhood obesity, smoking, and lack of knowledge about breastfeeding, are they very serious issues here in Brunswick County?
They are. Less than 2 years ago, the breastfeeding rate at discharge from the hospital after someone has a baby was about 11%. As of this last month, we are at almost 75% breastfeeding rates, and I must kudos the education being done in the office, in the childbirth classes, and then with our nurses. Childhood obesity in Brunswick County is at 32.7% of children are obese. Sad. And then smoking is about 30% of the population, and then that is not just pregnant women, but that would include the pregnant women. So definitely all three are problems.
So there's room for improvement.
Definitely.
Across those three initiatives. Yeah. Well, I'm curious, are there currently courses or programs that are part of the women's and children's wellness outreach?
Yeah, starting with breastfeeding, that education is now starting in the office. I've worked together with the director over there.
At the Novant Health OBGYN?
Yes.
Okay.
So when they come in, when they find out they're pregnant, at each office visit, which is at least every month, they are given simple but quality educational tools so they can learn the benefits of breastfeeding and what to expect. And then that is reinforced in the childbirth classes, and then really the message gets sent home when they come to the hospital to have their baby. We also have childbirth classes the third Saturday of every month at the hospital, and we just had a very large class this past Saturday.
Did you really?
We did. As far as smoking cessation, we just started our first 8-week course.
Yeah, I saw that advertised.
January 14th, and there's been great reviews. And then as far as smoking cessation focused on the pregnant woman, what we are doing now is in the office, if they are identified as smokers, or in the hospital when they have their baby, if they're identified as smokers, we refer to the North Carolina Quit Line, which is a confidential case management. They work one-to-one with that person to come up with the best way that they could be successful at stop smoking. And then we plan on, stay tuned, we are going to have a Women and Children's wellness event either later this year or spring of next year to really promote all of these topics and the wellness of Brunswick County.
Oh, that sounds exciting.
It does. Yeah. We're excited.
How about in terms of childhood obesity? Do you go into the school systems, or do you work with the school systems to address that?
We do. We're working with the school systems, and then Novant, we just had an innovation challenge, which included many members from the schools, members from the health department, and we're really working together to try to find that piece of where we, as the hospital and community organizations, can work together. So, definitely.
Well, great information, Kelly. You're just a wealth of information today. So tell me, how can our viewers find out more information about the Women's and Children's Wellness Outreach Initiative?
Well, they can call me on my direct line, and the number is 910-721-3038. 3038. I will be happy to speak with them and help any way I can.
Well, that is awesome. So before we close, is there anything else that you would like to add? Make sure our viewers know about?
I'm really excited. I think you're going to see a lot of education coming to the hospital and out in the community, and I love that we are able to collaborate with all members of the community, the health department, the pediatricians. So I think we have a great thing going.
Well, good. I do too. It sounds like an awesome, awesome initiative. So good luck with that.
Thank you, June, for having me.
You're quite welcome. And I hope you'll come back again and let us know how this initiative's going.
I sure will. Thank you.
Great, great. Well, thanks again for being here. We appreciate it.
Thank you.
Next, we will talk to Shelburne Stevens, President of Novant Health Brunswick Medical Center. Welcome to the show, Shelburne. It's such a pleasure to have you back.
It's great to be here, June. Thank you.
You're welcome. Now, for our viewers who didn't have the opportunity to meet you last time, tell us a little bit about your background and your education.
Sure. I got into healthcare years ago as a respiratory therapist, and after working in the clinical setting for a number of years, decided to go back to school and pursue a business degree. I did an undergraduate at High Point University, and then I did my MBA with Gardner-Webb University, and then came to Brunswick County in 2006 and been here ever since and love it.
Well, and we love it. We're glad to have you. There's been so many great changes at the hospital since you joined, and it's been a wonderful thing. So, now it's been a while since we have had you on the show, and I know there's lots of great things happening there. So tell us, what's new at Brunswick Medical Center?
Well, we've added a lot of new physicians. A lot of primary care physicians are moving into the area, which is greatly needed. We've added some new specialists, new urologists. We have some new technology that's going in. Most recently, people will notice that they have the iris scanning technology in their patient registration area. So that is a safe way of knowing that you're the right and correct patient, and they'll take your photo. So every time you come in, your picture will come up and all of your information will come up right away. So we're excited about all the new things going on.
Well, the other day I saw a little app for ER wait times. I saw a little card for that.
Tell
me about that.
With your smartphone or your iPhone, there's an app online that you can get information, like you said, around ER wait times, some of the clinic wait times, etc. With MyChart that's out there, you can have access to your information with your physician or make your appointments online with your physician as well.
Wow, that's pretty cool.
It is nice.
I like
use it myself every day.
Well, that's great. Well, today we wanted to specifically talk about the Novant Health Community Wellness Initiative that I'm hearing about. So first of all, how about explaining to us what the Community Wellness Initiative is?
Sure. Back in January, all across Novant Health, we declared a war, if you will, so to speak, around diabetes, hypertension, and obesity. They're very prevalent. They lead to more chronic illness, and we decided that it was time to declare a war on these initiatives and get out into the community and try to help keep our communities well.
Wow. And are those are three of the most prevalent conditions here in Brunswick County?
They are. Typically 1 in 3 individuals over the age of 20 have pre-diabetes. It's not quite diagnosed yet. 1 in 3 Americans have hypertension or high blood pressure, as most people know it as. And then 1/3 of Americans are considered in the obesity category.
So tell me, have there been any events in Brunswick County so far regarding this initiative?
Yes, we've had several. We had an initial kickoff with our employees at the hospital back in January. Also in January, we had one at the community college at the Fitness and Aquatics Center. Then with the Brunswick Beacon Health Expo in February, we held one there. And also CTRL had an event of Ask the Doctor where we did a lot of screenings there.
That's a lot of screenings in 1 month.
We've been busy.
I think you have. Well, let's talk a little bit about the goals for the Community Wellness Initiative over the next year. I think you're doing it across the Novant footprint. Is that correct?
Absolutely correct. At all of our facilities, we're reaching out in all those communities to do these screenings.
How many people would Novant expect to screen?
We hope to screen at least 500,000 people in the inpatient setting.
That is a lot of people.
It's a lot of people, but that's in our inpatient setting and outpatient setting. And we hope to reach at least 25,000 with our screenings of the A1C testing and checking blood pressures and doing weights and heights for your BMI.
Well, have we done prediabetes testing in the past?
We have not, but we did start in the hospital a while back of screening patients, maybe having outpatient surgery, even our inpatients. Because like I said before, it's one of the few diagnoses that goes undiagnosed for quite a while until you start having lots of problems with it. So in the inpatient setting, we started screening patients with the A1C test.
So help me understand, Shelburne, how the Community Wellness Initiative will be different from the patient testing that you just referred to in the inpatient population.
where we're actually going to be going out into the community to do these testing in all types of venues. We'll be working with our physician partners to identify venues to do this testing. So that's how we hope to target that large population number to do all of these screenings.
Well, that sounds great. And where in the community might these events be held? Give me some examples of where they might be held.
We'll do them really anywhere. We'll go to schools and to churches. We'll go into communities, large developments with the homeowners associating, any of their annual meetings or just gatherings that they have, anywhere that anybody wants us to come.
Wow. And that's all free?
Absolutely free.
Wow. That's a real bonus. Well, let's talk a little bit more about the screenings that will be done, the specific screenings, so that the population out there will know what to expect. So I know there are 3 screenings that we're doing, and one of them you mentioned, the A1C. So let's talk about that a little bit.
The A1C test is what we use to detect pre-diabetes or diabetes. Typically in the past, when you go to have a test done or at a screening, they'll prick your finger and just do a blood glucose. That test is not quite so accurate. It's just a one-time snapshot of the test. And if you had a soda earlier in the morning or you ate something that morning, it's going to affect that. The A1C takes a broader look and a broader picture. So it can look back to 60 to 90 days around your blood sugar levels and really let us know a more accurate diagnosis of pre-diabetes or even diabetes.
Wow.
But at our health screenings, we have a lot of healthcare individuals who will look at your test results and be able to dialogue with you about these and help you with the next steps, get you in with a physician if we need to. If you do have pre-diabetes, we can get you into a clinic so they can get you education on proper diet. A lot of our events, we have nutritionists there and dietitians that can also give you a lot of education and valuable information.
Wow. And the other 2 tests that will be done that day are blood pressure?
Yes, blood pressure checks. And also then we'll do your height and weight, which will give us what we call the BMI, your body mass index, which is a target number to let you know if you're in that obesity category or not, or if you're getting right on the edge of that obesity category.
So when you're there having the test done, you're probably in sort of an enclosed area, and then you have the opportunity to dialogue with your healthcare support person there.
Yes.
And can discuss the results and what have you.
Yes. I mean, we have a variety of resources from nurses to other clinicians. Some physicians do attend these, dietitians. So really it just depends on what we find wrong or even what questions you have. We can connect you to those right resources.
And if a person has the screenings done and they really don't have a primary care provider or in the area, might you be able to provide some of that information to them?
Absolutely. We have a list of all of our providers in the area, and we can get you phone numbers and help you get connected with any provider here in Brunswick County to get you in with a primary care physician or any other provider.
And speaking of that number and how to contact them, where might the folks in the audience, where might they go to find that information?
The phone number that they can call locally is 910-721-1473, or they can go to the website at navanthealth.org/wellness.
Okay. Well, that sounds great. I'm just so shocked that all that information and those services are available and it's free of charge.
It's all free of charge, and it just goes back to our promise that we rolled out last spring, that we're here for you when you're sick, but we also want to be your healthcare partner to keep you healthy and well. And
it sounds like it's going to be convenient, because we're going to come to you.
And that's part of our promise, too. We're bringing all this local and making it easy for you.
Wow. Well, thank you so much for being here today. You always bring us really great information and all this new stuff, and I can't wait to see what you have to tell us next time. So you'll come back, right?
I'll definitely be back.
Great. Well, thanks again for being here, Shelburne.
Thank you, Jean.
You're welcome. Our final guest is Sarah Brown, nurse practitioner with Novant Health OBGYN. Well, welcome back to the show, Sarah.
Thank you. Thank you for having me.
It's a pleasure to have you again.
Thank you.
And for our viewers out there who might have missed you the last time you were here, tell us a little bit about your education and your background.
Oh, sure. I am a nurse practitioner.
Yes.
Formerly went to nursing school at Rex in Raleigh, which was a 3-year program at that time.
Mm-hmm.
Worked for a few years in the emergency room primarily. Back then it was emergency room, not emergency department. And then went to nurse practitioner school at Chapel Hill. Graduated in '79 and have been working as a nurse practitioner since.
Well, great. Thanks for the reminder.
Yes, ma'am.
Now, I know you're with Novant Health,
Yes.
OBGYN.
Yes.
And I believe you have a few other partners there.
Oh,
so
yes.
let's talk a little bit about who those partners
We
are.
have 4 wonderful physicians at present. Dr. Tracy McCarthy is a senior partner. Dr. Lee Toller is also there, and Dr. Lee Shu. And as the practice continues to grow, we are anticipating having more physicians join us in the future. So that we're looking forward to that.
I hear it's really growing quickly.
It is. It
Yeah.
really is. It's
Yeah.
been wonderful to see. We have wonderful patients and wonderful services to offer, and we're delighted that the community is responding
Yeah,
beautifully.
they're embracing that
Yes.
practice. Well, let's talk about the services that are offered at Novant Health OBGYN.
Of course, being primarily and essentially OBGYN,
Right.
anything that's female related. In the past, a lot of women have used their OBGYN physician as their primary care provider. Which,
I'm one of those.
me too. And that has become a little more specialized. So traditionally, it's basically female and female related issues. There are some things that if we can help a patient manage in a transition period as they're either establishing with a new primary care provider or something, there are always options. But that's our main, is the female health and well-being of women of all ages.
At what age do you start seeing females?
I actually have seen patients as young as 8 or 10.
Really?
But that would be an unusual situation or a referral for some reason. And I think the oldest female that I've seen was in her 90s.
Wow. So we start when they're teenagers
Yeah.
or even younger,
Yeah.
and through the baby booming years, and
Right.
then on into menopause.
And I have found that a lot of our younger patients are a bit fearful because they think if they're coming to a gynecology office that they're going to have a pelvic exam, and that's not necessarily true.
Really?
Often it's just let's find out what's going on, talk, and it doesn't have to be anything that they need to be afraid of.
Well, speaking of services and exams and what have you, as a nurse practitioner in the office, what role do you play?
I do a lot of the new OB visits, the interviews and exams. We also have Annika McNichol, who's one of our senior nurses, is doing a lot of the interviews now.
Oh.
And so I see most of the new OBs for their exams, and we'll follow what we would consider a routine OB until around 36 weeks, and then they start meeting with the other physicians. Of course, if they prefer or need to see a physician, that's always an option.
Right.
But I do routine, health and well-being exams, pelvic exams, pap smears, biopsies,
Wow.
that sort of thing.
Pretty much everything.
Yeah, it's a nice spot to be in.
Wow. Well, today we're going to talk about endometriosis,
Yes.
since March is the Endometriosis Awareness Month.
Right.
And first of all, I guess you need to tell me and our viewers what endometriosis is.
Right. The simplest way I found to explain it to patients, and it's simple for me to understand, is that for some reason the lining of the uterus gets kicked into high gear, and we're not sure why. And therefore the lining of the uterus that's maintained mainly in the uterus and stays there, and we slough some of the lining, goes into high gear, and there are areas that come out and implant in the peritoneum or in the pelvic cavity and even in the abdominal cavity and cause problems with scarring, and adhesions are developed, which is when tissues kind of bind together and can create problems with pain and irregular periods, infertility, urinary problems, bowel problems. It can be pretty impressive.
So the symptoms are what you just mentioned, then the pain.
Some people have pain only with periods. Some people only have pain with intercourse. Others have pain that is intermittent, but primarily with menstruation. Those who have chronic pelvic pain are often difficult for the patients themselves to manage because you have to figure out what's going on. We assume as women that if we have pelvic pain, it's got to be female related, and often that's true, but not always. So it can be frustrating for patients at times to go through the process of
Sure.
ruling out bladder, ruling out intestine. But it's a process and it's manageable.
And speaking of manageable,
Management?
how would you manage that?
It can be managed and hopefully lower pain issues using traditional birth control pills to suppress the ovaries and the endometrial development. Use injections like Depo-Provera or even Depo-Lupron, which puts women into a chemical menopause and just stops the process. And we also use anti-inflammatories like ibuprofen or naproxen, which we use at prescription strength. And so there are options.
Well, by having a hysterectomy, would that cure it?
That is the hope, though you can never actually say it's going to cure it.
Really?
We always tell women, that's our hope, that's our gain, or the aim. But if there's even a tiny bit of endometrial tissue that can't be retrieved, then it can continue to grow. So the hope is that, yes, that will resolve the pain and end the pain. And I would say for the majority of women it does. And that's a definitive treatment for women who are, of course, through attempting their childbearing years.
Sure. Well, are there tips that you can give our viewers out there? If they think they have or may suffer from endometriosis, what tips might you offer?
They need to see their provider.
Yeah.
And there is a slight increased risk in women whose mothers or sisters have endometriosis. They have a slight increased risk. And it's mainly seen in women in their mid-20s to early 40s. But if you have symptoms of difficulty with urination, difficulty or pain with stooling, painful periods, that sort of thing, we just need to know.
Well, that's great information. I think it's probably not a well-known topic out there in the viewer world. So I think it's great to have that discussion here.
Yeah. Women also need to know that their level of endometriosis, which is graded, grades 1 through 4, their pain is not reflective of how bad their endometriosis is.
Really?
A person who can have grade 4, which is impressive implants in the pelvic area and endometrial area, may have minimal pain.
Wow.
And yet someone with a lesser area of involvement may have more significant pain, depending on where it is.
Wow. It seems like it would be the
It
opposite.
seems frustrating.
Yeah.
It seems like it's
frustrating, yeah.
daunting, but it's manageable.
Well, great. That's good to hear. Getting back to you personally, do you have any special interests that you like to address or special areas that you would like to discuss with our viewers?
Sure. I enjoy adolescent and teen GYN care. I love obstetrics. I really do. I enjoy that. I also enjoy the geriatric population because I'm there now. And
Makes it easier when you're there.
It does. I can certainly understand and appreciate
where they're coming from,
absolutely.
right? Yeah.
And we're fortunate. All the physicians in our group have wonderful skill sets, and
Well, they have excellent reputations.
they do.
In town.
I'm
They do.
delighted to be part of that practice.
That's awesome. Well, are you accepting new patients?
Yes, we are.
Great.
Yes, we are.
And how would we go about scheduling an appointment with you specifically?
Just call our office number, which is 910-721-4050, and they can make an appointment with the provider of their choice.
Of their
They don't
choice?
have to see me. If they choose, that's certainly an option.
Well, that's great. Before we close, is there anything else you would like to add, like to say to our viewers?
No, it's just we are here to serve our female population needs, and we don't just focus on the female, because I hope that we are looking at the entire family. Especially with our OB patients and the women who have
sure.
endometriosis with chronic pain. It's a family involvement with their partners or spouses, and so it's something we like to focus on everyone, but provide the best care we can.
Great. Well, it was such a pleasure to have you back on the show. It's always a pleasure to have you
I enjoy
here.
seeing you too. Thanks.
Great. Well, come back soon.
I will do it.
All right, thanks. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, local doctors, and general health information, please visit novanthealth.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.